sure some of you have some coffee and or whatever you drink in the morning. I appreciate everybody coming on. This is very trying times for all of us, and especially with school and having to decide and look at all the things that we need to do. Obviously, one of the big things that is that how rapidly everything changes. And, I thought about this today, and then I'm going to open the floor up to some questions. I thought about this today that, when we had to close the school on March 13th, it's basically only been 4 months, but I know it seems like it's been about a year. So I often ask superintendents or principals, and most superintendents can't remember anything before March 13th. So I thought that was kind of interesting to hear that. But we have some teachers on here today. Feel free to ask a question. We have some parents, and we have some couple principals. If they had a question, you may ask a question. We may not have the answer, but we may have the answer, or we'll go from there. So does anybody have just a general question to get started? And that would be fine.
Well, I guess the elephant in the room is, what are the plans for opening up?
That's a good elephant. Tomorrow at the board meeting, I'll present a general plan, and what that is, under the Pennsylvania PDE, we're required to have a plan, a health and safety plan, before we start school. So that being stated, you have that plan, but it also can be a plan that is the way you have to look at this plan is it's a living document. And the reason you say this is you're going to maybe have to adjust it as you go. Well, not maybe, you will have to adjust it as you go. Case in point, if you saw the news, at least yesterday, I don't know when it's taking effect. There are 7 or 8 counties in this area that they may change the designation to. Now, a lot of that has to do with businesses, but of course, if school was in session, it would signify school. So I know Allegheny County, Lawrence County, those particular counties, Washington County, Beaver County, they may change to yellow or even red, depending on what the information from the Department of Health. From our perspective as a school district, for example, red means that we don't have schools. So schools do not have any choice in the matter when it comes to red. So everybody knows that. Yellow and green is more locally determined. When your county is yellow and green, what you may want to do based on ideas such as, can you social distance? Can you do certain things? The big part of this, which I don't think most people think about, is what do you have to do when you have your own particular sicknesses in the school. So, for example, if you had 3 or 4 or 5 teachers or staff members or students in a particular grade, how would that affect your planning in that particular school? And those are the things that are the toughest for us to deal with, and know exactly what to do. I'll give you a couple examples. And I'm still going to go back to your question, Tom, about what the plan is. But this all feeds into the plan. The situation with people getting sick is something that we've asked for from the Department of Education and the governor and the Department of Health. Obviously, the Department of Health has the most power in a sense because it's no different like when you get measles. If you had a measles outbreak, they could close your school district down because you have too many measles, which has happened. I think that might have happened in New York last year. So how you deal with these particular issues of COVID and those types of situations when people get sick will be a determining factor in whether you have to change your format for school. That being said, one of the things I'll introduce tomorrow and talk about a little bit here is an introductory phase of 3 weeks when we start, because there's a multitude of factors that are to take into consideration. One, it's a whole new school atmosphere. I think most of us that have been to school, most of us have graduated from school, or most of us that have been in school a long time, look at school a certain way. You come in, you go to your locker, you go to your classes, you meet your friends in the cafeteria, you participate in something after school, that kind of thing. I think all those things are subject to change, and I think it's very difficult to just start out with everybody in the school. So one of the recommendations will be to divide the classes K to 12 into halves, and that's for the beginning of the school year. Now, what will happen is that'll be a 3-week period, and one of the advantages we have at Wilmington, we've worked hard to improve on online teaching as well, to where we can go hybrid teaching online, which means that if half the class is here, the other half of the class can be in the class as well. And what that constitutes is teachers will have to them available what we're calling, it's a workstation, battle station, whatever you want to call it, that has their laptop. It can have a document camera or a iPad to, it can take pictures of documents you have that you want to show to everyone in person and at home. It will also be, obviously, you're connected to your no longer whiteboard. I would call them, Matt just called them televisions nowadays. Is that the best term?
Touch displays.
Okay, I want to get that right for all the technology people out there. Yeah, there'll be touch displays, and you can also even will this around. So if somebody says, hey, let's say hi to Johnny, it's his birthday, can everybody say hi to Johnny? Everybody says, yeah, let's say hi to Johnny. They can do that. So it's very different than probably the Google Meet was before. So that's a little bit different. One reason to practice that at the beginning is if you have to go to an all online environment based on a red phase or something like that, you're prepared. The other thing is huge is how do you do social distancing? And in order to do social distancing, you need room. And high school, for example, which we're talking about here, or middle school, it's very difficult to fit, 22 kids that are bigger in a classroom. So that's why you would signify doing halves to start, so people learn where to sit, how to interact, how to exchange hall. A big difference will be eating in the cafeteria. Cafeteria will be spaced out. Some students will be in a part of the cafeteria. There will be a big, huge line that's been designed that you go in a different door and you go line and you get your food and then you go out, or you're in one section of the cafeteria. We will use the gymnasium as an area that we will also use for cafeteria. So all those things are things you have to get adjusted. Now, as of last week, or maybe the beginning of the week or the previous Thursday, I apologize. You get a lot of information. I can't remember the exact date. The governor sent out a mandatory mask wearing rule. And initially that rule was made for the public that said when you go into a situation other than, I guess, exercise, you should be wearing a mask. They had on there that you were not required to wear a mask if you had a respiratory issue, and but you did not need to provide documentation. Well, schools had meetings with the Secretary of Education and asked these questions because obviously there are certain students that the nurses or their teachers know that they may have a respiratory issue already. We don't know if everyone has a respiratory issue. That being stated, they came out with information last week that you can find on the PD website. And tomorrow, when I talk about a little bit about this, I'll try to flip over to that to show. Basically, if you cannot wear a mask, you have to have that documented, that you cannot wear a mask. Now, obviously, documented, and it'll be part of the IEP team if that's significant, or doctors and nurses, the school nurse, that kind of thing. So that's something that's a whole nother thing to learn about. If you're wearing a mask in the hallway, you're wearing a mask on the bus, you're wearing a mask in a classroom that can't social distance. Hopefully, once it's all said and done, all of ours can, which would alleviate a little bit of that based on the information that you could remove a mask if it fits the situation to get some reprieve in a classroom. That's hard to say yet because we haven't completed every single move, but I think that's something. But one of the things we're looking at, and Mr. Wright and Mr. Quad are thinking about as well, as far as middle school and high school, are particular mask breaks as well. You know, you can take a class. I'm online. You know, the schedule may change a little bit. We're going to meet for 30 minutes online, and then I'm going to tell everybody at home, okay, we're going to take a 15-minute break. You can read this while we're doing this. I take the class outside for a 15-minute break. They space out. They can just, you know, get some breathing in and go from there. So that is the basic plan, is an introductory phase. And then you meet again as a transition team and the school board as well. And you talk about how it's going in the first 3 weeks. One of the big areas that you need to look at is it seems that there is more information as of yesterday that I saw that it seems to be transferable for students, especially over 10 years old. And now it doesn't, you know, all the science isn't there about what it all does to children, obviously, but I do have to say that my experiences of being in a building with the H1N1 back in 2009 was how rapidly it traveled through the group. And that was without any type of masks or any type of social distancing. And what happened was that I had 117 kids out after one day. And what was ironic about that is my friend worked for Procter & Gamble and was in China dealing with their SARS epidemic back in the day, or not the SARS, the bird flu, I'm sorry. And the first thing he called me, he said, how's it going? I said, well, I got this going on all of a sudden. They have a vaccine, but he said, well, the first thing you should be doing is wearing a mask. We never did go to a mask in that case. They kept us in school, but it was visible. It was very visible that students were very sick. Obviously, this is a little different because people can be asymptomatic, or they can have a symptom and don't even believe it. So I think that's one of the curveballs you get. So that being stated, my recommendation is more of an introductory phase for the first 3 weeks, followed by a reevaluation or redirection, which means it could stay the same. You could look at adding more students depending on the grade. You could add students that are in need of being there every day because of specific learning needs. And we're also going to have to, you know, it's also a mindset for teachers that they're going to have to learn how to do this. This is not, I think one of the tough things about this is teachers have been asked over the years, probably when I started teaching, to be they were a teacher and a little bit of a social worker and a little bit of a guidance counselor. Now they've added those full-time jobs. They've added a little bit of a security element. They've added a lot of things to their plate. And now they're a crisis responder and a teacher at that time. So from a mental standpoint, they have to prepare for that. And I think being able to teach your students how to deal with this and how you're going to deal with them is vital. So that's basically how it worked. Now, I sent out, we put on the website about learning pathways. We have 3 types of learning pathways. One learning pathway we call Greyhound learning. Not to get boggled down in all the terms asynchronous and synchronous, because those are terms that people get confused, including everyone I know. So the Greyhound learning was same time learning, meaning you were a student, you signed up to just go to school like we always do. We didn't sign up when we went to school. Well, they didn't sign up. They're going to stay that way. And they will follow whatever the school does. So If you're online, you'd be online. If you're all there, you'd be all there. If it's a hybrid, you would be hybrid, depending on how that's formulated. Another option is to be a Greyhound learner from home, which means I'm a part of the class, but my parents and I have made the decision, or my parents have made the decision to say that, you know what, I'm going to be at home online, which means that I'm going to be live when the class is live, and I'll do my work and I'll attend every day just like every other student. So, but I'll be there from the computer, but I'll be able to meet up with my classmates. The other is a asynchronous option, or a anytime option, which means my family's situation is one that my child, I don't want them coming to school, but I can't have them meet at the same time because there's some other responsibilities in the house. So for a couple hours in the morning, they need to help me with this, which happens under these conditions. And then that would be an asynchronous option where you would do work online, and our teachers would monitor that. We're doing that through Seneca Valley. Seneca Valley has a tremendous amount of experience. They've had over 12,000 students, and also I don't know how many schools, like 25, 35. I don't know. Mrs. Cavarina would know how many schools they have under contract right now that use their system. And we would do that. One of the things they can do is give us professional development. They can add things to a course. If they know something we do, we can add things to a course. So that's all optional, and we can always change the course too based on the student's needs. So those are basically the learning pathways, basically looking at the three areas that you could partake in school. The other thing about the introductory phase, we will also review this again in August 11th. So August 11th will be a board meeting, but we can look at that because we have no idea what might partake until then. Tomorrow I'll show some of the survey, the parent survey we took, which was pretty much what most schools have thought they would be. One of the things, though, in there, for example, was just about like mask wearing. That was not really an emphasis back when we gave out the survey. Now it is, and it's a mandate from the governor. So as a public entity, which a school district is, we have to follow those guidelines. So that wasn't really part of it back in the time. It was more about hand washing, which is still important. It was more about social distancing. So things change, and my point is, in August, when we get to August 11th, which is another month away, say, things might change again. So that's the general gist, Tom. I hope I gave you an answer to that is relatively clear, as clear as I can make it for a 1-hour coffee talk. I have a good question online, and I don't mind having an online question here. It's kind of, feel like one of those sports guys. Let's talk to so-and-so. Would there be leniency on attendance? I think one of the things is there has to be some leniency on attendance, meaning that traditionally, schools may have been hard line with so many, and you're going to the magistrate. I don't see that happening now. Obviously, you have to attend courses in some respect, but I think our teachers have done a really good job to work with people on that. One of the areas that's very interesting is that what we'll do is the nurses are developing, and I think they have it already, but like a template or a sheet or whatever you want to call it, that parents should review with their kids. One of the things I think that has been historically so at Wilmington and a lot of other places, especially in Western Pennsylvania, where you get a lot of hardworking people, we've all come to work sick. And I think that's something we really have to look at. So what you would do is at home, you could have a little checklist yourself. You could laminate it, or we could get it laminated, whatever. It would say, does my child have a fever? Does my child exhibit aches and pains? Were they around anyone who could have possibly had the COVID? You have to answer those questions. And as I say in my presentation tomorrow, it really takes a whole community to get through this. This is not an isolated event if you're a part of a school. So I think, that is huge. And as far as the attendance is concerned, we'll take that as we go and work with children. And, maybe if you're someone who keeps getting sick, maybe it's best for you to be online. That's one of the advantages of having the hybrid option of you're online with your class. So if you're a little sick, you can still tune into the class. And I think that's awesome. Another question is, one of the big areas, of course, is teacher accountability. One of the things that was different last year is we were thrown into this all at once, and we did an okay job, better at sometimes and less at other times. But I think one of the things but if you go into a red phase, for example, then you are totally not in school. Question would be, as long as teachers are allowed by the governor to come into work, they could teach from their classroom. So that being stated, I think that gives a different ambiance to students, that I'm teaching from my classroom. Here's the what's that called again, Matt? The television?
Oh, the touch displays.
Yeah, here's the touch display. I got to get practice at. This is the touch display. And this is our lesson. This is your homework. We expect to run this just like we do a regular academic year. I think there are some key factors. One, you need to see in certain classes where students are, and this goes for all grade levels, depending on the class, where you can reach out or improve, and then, how the rigor needs to be implemented where it starts. So those are all things that are important. Another one is some teachers may compact the curriculum, which means that they realize that in this particular class, they remember everything from last year after a day or two, and we don't have to go over that part. So you're compacting the curriculum to make it more significant for that particular group, which I think happens in a regular school setting as well. So we expect to run a regular school year with the same kind of assessments, same kind of grading that we've kept. Some of the other schools went to a different grading system at the end of the year, basically just a pass fail. That happened a lot in elementaries, but a lot of people did that for high school. And we kept the grading system going. But some teachers met it more often than others. In this case, they would meet based on the schedule that is given to them and meet with their group. One of the things we are definitely looking at is when you're in the middle school, high school building, we may cut down on the schedule as far as number of periods that particular day. So it may go to a 6-period day as opposed to a 9-period day, but the next day would also be a 6-period day, which means that 3 periods would remain the same and then 3 would rotate. However, we are going to extend the time for those courses that don't meet every day. A lot of that is related to the health issue. If you look at the data, and I'll show this tomorrow, there are some areas that are the biggest areas. If you look at communication, infectious disease, and you look at the areas, they're basically the areas of the community. There's the lunchroom, there's the classroom, and there's faculty interaction. So faculty interaction, the lunchroom, the classroom, the community, and there may be one more that I just can't think off the top of my head. But actually, through the federal government's grant, Pennsylvania did a huge study that for this particular thing, and they did a lot of simulations showing how quick it is to get 5 infections, meaning that when you get to 5 when you find an infection, you probably already have 5. I think everybody must realize that when we come back to school, we're going to have people that are either have or will be infected. It's just too contagious of you're not going to stay at zero. That being said, when you look at the areas that you need to control as a school district, you want to control the lunch, the cafeteria. You want to control the classroom. You want to control faculty interaction. You can have kids socially distanced and everything good, and then at the end of the day, 7 teachers get together and talk about the day, and they're not social distance, and they're not, so that hasn't helped the day much. So when you look at that, and I show that, I think that's one way you can really get an idea for how important it is to social distance and keep areas such as lunch and classroom so important to keep the flow of infection away from people. I'll give you a little bit of this isn't in stone, but this is one of the things. I had somebody talk to a pretty big doctor out there that is well known. And one of the things they talked about is if you look at the person anywhere who is the someone who has COVID, they know they have the COVID. Anyone near them or anyone in their family, for example, would be someone who would be the first level of people that may have it as well. So that being stated, for example, if we had a parent at home that has the COVID, they know they either work somewhere or something happened, they were tested and they know they have it. Well, they call the school and they say, I have it. I just want to tell you that the Department of Health has told us that they want me to keep my children home, and I'll keep you updated what's going on with that. That's fine. In that particular case, the children of that parent are what's called they're a 1. They're the first level. So in that case, they would be recommended to stay home from the Department of Health. Now, the child has not been determined whether they have it or not. So in that particular case, all the people that child has come in contact with under the Department of Health guidelines, they would not be quarantined because they are not a first level. They did not have interaction with the parent, if that makes sense to you. Now, in another situation, you could have a teacher, and we're looking for better description of this from the Department of Health. By the way, the Department of Health is supposed to help us in all of this, and this is one of our concerns as superintendents across the Commonwealth, is are we going to get that kind of help from the Department of Health when you have 520 school districts there and every school district is asking for assistance? Do they have enough people to do that? So if you have a teacher or a student who, say you had a teacher and they call me and say, Dr. Matty, I found out I had the COVID. Well, if those students were in the class with that teacher, not social distancing especially, but in the class with the teacher for a certain length of time, then we would have to determine based on the Department of Health recommendation whether those students would have to be quarantined. That being stated, that is one of the reasons for the introductory. I keep saying that being stated. I apologize. I've been writing too much. That being the case, that's one of the reasons why I feel that it is improper to open everything all at once, because there are going to be cases and you are getting people coming from outside. They're going to vacations. They were at grandma's house in Ohio. Grandma was in Florida for 2 weeks. We can't do that right away, because if you happen to have a teacher or a student right away, it could pass through your entire school and shut your entire school district down, which will be probably more than 14 days in that particular case. If you had that many cases, that's my point. If you have 1 or 2 cases, you can always close the school for 1 or 2 days for cleaning. And anybody, part of that's going to be contacting the people that need to be contacted that are not going to be in school, if that makes sense, that should be quarantined at home. As far as staff, one of the things we're trying to develop is the staff to have a app or a login that they can go into in the morning and they can just review it. And then their final question is, I'm coming in or I'm not coming in. They can review, do I have a temperature? Am I feeling okay? That kind of thing. And that would be an easy way for them just to say, yes, I am. And that's basically all I want is the one answer that I'm coming in or I'm not coming in. And we're really going to emphasize that you have to have professional responsibility. You need to say, hey, I'm sick. I have a little bit of something. I went to, Dr. Matty's birthday party online, and I think I caught something off Mr. Quat. Well, then, you may need to stay home for a little bit until you're feeling better. Because the other thing is too, obviously, many of you, it's very difficult to find testing and or that type of thing. So one of the things that everyone must realize is a lot of this is going to be dictated by the Department of Health. We cannot control the testing. They have not given us any particular mandates about testing per se and privacy and those types of things. So they're basically saying, well, you keep it private as you can keep it. Well, that's good. But they haven't said, well, when you do this, we want you to go to this place and they're going to have to get a test. That's not out there. So that's another reason why. How is it going to happen all at the beginning? The two most important people, I know everybody here on this line is important. The two most important people right now when we start school, obviously, are our school nurses. And we want to help them in a sense that, don't send your child to school because they fell on their bicycle and you want the nurse to check them out if they hurt their arm. You need to take care of that as a parent. They're going to be, we're actually probably in a lot of cases going to limit the trips to the nurse's office for things that are not related to, if you get sick, obviously we'll help you. As part of the mandate from the state of Pennsylvania, we'll have areas isolated. As far as the middle school, high school is concerned, we have a room that we will use next to the nurses area that will be an isolation room if someone exhibits temperatures or sicknesses that could be some of the signs of a COVID situation. They will be there until they're picked up. So that's part of the mandate from the state of Pennsylvania is an isolation room. How about another chat? Let me go down here, see if there's another chat question. People, some reason, I must have a voice like a good singer. Everybody wants to hear me talk. There's a question: if someone travels, are their children still able to come to school? I would say yes. I'd say the only way that would be no is if the person that traveled, first of all, the person traveling isn't coming to school, and if the person that traveled was infected, then the child would have to stay home. Think back to my 0-1 situation. So that's as clear as you can make it, One of the questions is about choir. Choir, what's so ironic about this? I don't know if it's ironic, but strange. Is if you're online choir, you can do. If you're in person choir, you really can't do because of the expelling of the air. So we're looking at now how we would do that, if it would be more of a theory class in that sense. Or if you're home, you would do the chorus while here you're doing more of the theory and learning more about music in that sense. So that's something we're looking at as well.
Dr. Matty, can I jump in with a question?
Yes, you can, sir. Thank you.
All right.
Give me time to get coffee, which I called this thing in the first place.
Okay. Regarding wearing the masks, and you had said, about the exceptions for respiratory disorders, there's also exceptions for communication disorders.
Yes.
Hearing loss. And as far as teachers wearing a mask, will we, I would hope, be wearing face shields and not
masks? We're going to give the teachers both.
But I would recommend that we don't have an option. We wear shields only because the masks do inhibit.
Well, it depends on where you are. So, for example, if you're in the hallway, it's much better to wear a mask. Now, if you're going to have to communicate with it, if you're a teacher of the deaf, for example, you would have to communicate. But we'll talk about that later. I think it's a good point. We haven't come to the final conclusion on that, but I want teachers to have, for example, you're an elementary teacher, facial expression is important. So we definitely want to do that. I said respiratory, but it's more than that. It's anything it's under like health and ADA compliant issues, that type of thing in the law. So as long as there's a situation where a medical doctor, says that this is the case, then.
And I believe the exemptions are written in a way that if a person does have a hearing loss and has communication issues, anyone trying to communicate with him is exempt also.
Well, that'll be up for debate. It depends on where. Obviously, if that person's in your class, wearing a shield in that case would be very positive. I think that would be right.
And their friends around them also trying to communicate, I believe, are exempted also.
Well, I think here's the thing. If you're in a classroom and you can social distance, then you can do that. But if you're in a classroom where you can't social distance, it takes a whole nother precedence. So I think you make a good point.
Okay. And I have another question regarding, I think you said that the first 3 weeks would be only partial kids in the classroom, and then we revisit for kids with IEPs. We know that some kids that have IEPs need to be there every day. Is it possible to just start the year with them there every day, given that we know
IEP is a pejorative term, meaning that it's more than just, there's all kinds of IEPs.
Sure. We know that there are some students that
I'm working with the special ed director to discuss if there are students that would start out that way.
Okay.
The other thing is too, though, but also just because you have an IEP doesn't mean that you're ready for the mass of people either. So it may be that they would start maybe all the second week, for example, or all the third week. They may not be out the whole first 3 weeks. It would depend on a multitude of factors. And certainly I understand that there are students who need to be in the school as much as they can. So that's all. Yeah, that's been discussed.
And I would hope that we can start the year with them.
Well, we'll see. I mean, I think right at the beginning of the year, it's going to happen. Now, part of that is how many are you talking about? I don't believe there's as many as maybe we think, or there might be more than we do think. But I think that once I get that final answer, then we can look at that. But that's definitely in the works, Mr. Kerr, and I appreciate that.
Okay. And one more final question.
Yeah.
I know some schools, Mohawk in particular, have had reservations about live streaming the entire classroom due to HIPAA concerns.
Yeah, I'm not worried about that. We've gone through that before. It doesn't mean we have to show necessarily the students, in the class. The main part of the class you're going to show is the touch area. But you can also show if I'm writing something on the board, or if I just want it to come on to me, we have that option. So that's a particular choice for each particular school to deal with. Obviously, there's a student that the parent doesn't want them to be seen. We're not going to tune in on that student. They could raise their hand and answer a question, but they don't need to, because that's no different than being there in that case. One thing, Mr. Kerr, and I think you agree with this, the law is always way behind technology. And so they don't have that always spelled out the way people need it this time. But that's a good question. Thanks.
All right. Thanks.
Do I have something on here? Let me look on the. We have all the equipment purchased. Mr. Main, why don't you tell us about, do we have most of those items in already, the particular battle station stuff?
Almost everything is in. If not, it at least has been ordered. Minor delays, but everything should be in on time. The biggest thing we had that we could not get on time this year are new Chromebooks that we purchase every year anyway. But we've mitigated that problem with another solution. So we're in good shape.
Good. Question about sports or extracurricular. A lot of that's going to have to be determined by the PIAA. I've actually heard that our school district is under what's called the District 10. The WPAL, which is by Pittsburgh, is the WPAL, which is District 7. I'm hearing that they are actually going to put their own non-playing situation out. I don't know that. I do think it's up in the air, but it looks like the NFL is debating, and we should know this week because players are saying it's too early to go back and practice. Now, these are organizations that can test everybody daily. And colleges are not going back yet. So I think that's something we're all waiting on. And actually, my preference is they delay it. Have all the sports, just have it at a different time and do that. There is some information. Someone asked a question about pediatricians saying that studies that kids cannot carry the virus. I think I would refer to you to yesterday. There's an article from South Korea that they did a huge study on that has kids carrying the virus. You in this position I'm in, you have to take in all kinds of information, and you try to separate and take everything at face value. It's very difficult. There's all kinds of information now that a bunch of 1-year-olds have it. Now whether that transfers to the parent, that's a whole nother ballgame. The South Korean study did say, though, that for kids over 10, that it was quite easy to spread it. And one of the theories there was that because kids are bigger, they're able to do that. Now, the one benefit of this whole thing, I think that the science is getting better, and they're also going to learn why kids don't get it as much. Kids get it, but why do not they? I remember back in the H1N1 days, it was the exact opposite. I had over any one day 200 to 300 students out, but only had 2 teachers. And it was like the teachers already had an immunity to it. So it was kind of the exact opposite of what you have now. And I think this is one of the things everyone has to realize. In theory, you believe you're going to have your teachers every day all year. That doesn't even happen in a normal school year. So you have to realize that there are going to be family situations with that particular teacher where they can't be there. Now, you may be able to hire some for them or get a sub. But if you look historically the last 5 years, all schools in Pennsylvania, it's much harder to get a substitute teacher. And those types of things are going to be more difficult in different ways of doing things that make it harder to maintain your staff. So I think that's a factor in all this too, that even though in this case, I think teachers obviously have always been essential workers. But the key with that is you want to keep your essential workers safe as well. So those are all in the formula. One thing with the sporting events, someone asked, what about right now? For example, if you had a football game and you can only have 250, I think a lot of that depends on, if each team has 50 players and somebody has a band, and then you have referees and you have some other, officials got to be there or scoreboard people, that type of thing. Then you limit the crowd if you can have the crowd. So that's something that we'll decide once we get that. That has not been determined, and they have not given us. That's one of the reasons why, honestly, I believe that the PIAA will come out with a delay. They will delay all the sports because they haven't given information enough to handle the situations of having games and whether you're allowed to have people there or not. How about another question or comment without online here? Then I have one here that I can talk about, but does anybody have a? Mrs. Cavarino, you said that was how many schools, by the way, with Seneca Valley?
Currently 65, but they have several contracts in the works.
Okay, so 65 schools are tied into that, which makes it nice because you can probably talk to other schools. Like if you offer a class that is like a unique class, like one class, they might have some ideas for that particular class. Like people could ask us about introduction to agriculture, for example. That would be one. Someone asked the question, do we use lockers and book bags allowed? Right now, we've talked about allowing book bags. Lockers, we're going to limit the use of that to the beginning of the day and the end of the day, because lockers, one, kids have a tendency to touch lockers too much, and two, the locker is a place of it's like the water cooler for kids. So Michael Wright is at his locker. Well, let's don't pick Michael Wright. Let's pick somebody with friends. Ali Cavarino is at her locker, and we go and we all congregate at Ali's locker. Hey, Ali, how's it going? Da-da-da-da. Can you believe that Michael Wright, what a jerk he is in class? And we talk, and then, we're going to stop. So we want people getting through the hallway, and the locker would be basically a place for your coat and a place for your, your lunch. If you bring your lunch in, you'll probably be able to go directly to the gym area, which will have really spaced out, and you can sit there and you can probably, I believe we're setting it up where you can buy, if you want to buy a drink or some other items, you may be able to do that. So you wouldn't have to wait as long in a line. One of the things with the cafeteria we're working on, doesn't mean it's going to happen yet, but it's in the works, is to try to, pay without cash and that type of thing. So those are all good moves to alleviate some of those issues. The big thing I'm looking at now is ventilation. You have your windows open, you have your doors open when you teach, things like that. We will be getting new windows. They're still not, some are here, I believe, but they're not all here yet because they were made in Michigan. But those windows will be put in around the kids. They're not a hazard for the most part, as long as you're not in the room. So we could move a room and do that type of thing for that while we put in. They can also work in nights and weekends if feasible. Excuse me. A lot of sports questions, which are not bad. Let me see if there's something else here. A good question about hybrid to online, online to hybrid. I think that kind of, if you're on the hybrid situation, you're kind of online anyway. So as I said earlier, if I'm in group one or A group, Mr. Quat's in B group, I'm in school for the second week. I'm there all 5 days. Mr. Quat's online. If I couldn't come because I was sick or my parent had to be home or whatever situation, I could be hybrid then. Yeah, that's not going to be a problem. The biggest problem you have is if people choose a only hybrid option or an only asynchronous option, then we'll have to look if it's feasible for them to come back and forth in that perspective, only because of logistics. Remember, we're going to have so many people. We can only have so many people on a bus. I believe on the survey, about 40 to 50% of the people said they would drive their own child to school. So that wouldn't be relevant for them. But, you can't add 10 people to a bus overnight. So those are just the things that you'd have to look at. But that's a very good question. Safety drills. Yeah, that's a good one. That's something, Mrs. Triplett, I want to appreciate you putting that up there. Has it been determined how the safety drills will look? No. And the reason that is, we can always do an internal safety drill where we're protected against intruders per se. But the state for the last 50 years has required fire drills in a way that we need them to give us some type of guidance on. Everyone's going to try in schools to do staggered dismissal, meaning, the following rooms go. And then, then the next group go, just so they're not all in the hallway at the same time. Well, if you all go out in the hallway during a fire drill, that would be more difficult. We will look at alternative routes. Mr. Joel will look at that. If there's something that we need to do, for example, too many rooms are going to this exit where there's an exit right here we can use, that type of thing. So that's a very good question. I do think that the safety of all children outside of the pandemic has really been ignored by politicians. And I think that's something that a lot of people keep saying, well, go outside, go outside. Nothing wrong with going outside. We've done that, but we also take safety precautions. And I think those are things that people need to realize what to do. There's a question about introducing fifth graders to the middle school. And I believe, Mr. Quad, if I'm not mistaken, you're going to do, once we get closer, some type of online, probably introduction. Am I right on that?
Yes, I've talked to my transition team, and what we're going to be planning is as soon as we are able to pick a date, then we will look at having some sort of basically it'll almost be a town hall meeting.
Yeah.
We have to do something this year for all students K to 8. I'm sorry, 5 to 8. Basically because obviously there will be a lot of changes for students coming into the building this year that will affect everybody. And we do need to meet with everyone. But with regard to the fifth grade too, we'll be able to make sure that they can at least see their teachers and have the opportunity to possibly ask some questions, let them introduce themselves. That'll be later on, though. Sometime I'm anticipating sometime mid-August.
Thank you. One of the things you just reminded me of is we have in-service days throughout the year. We're going to take one of those in-service days where we train teachers, and it's going to be before the school year. There's usually 2 in-service days and a teacher day before the school year. We're going to add another in-service day beforehand for additional training, one for the teachers to work on how they deliver their instruction online that's very productive, and then other ways. A good question on here is, when kids take a break, if they go outside, we will have to have that in a sense that one of our security officers will be available to go out with them or be near there. So that's something that we would take into consideration. One of the things that everybody must realize is we will not have visitors. We may have a visitor, for example, for a student that has needs of occupation or physical therapy that outside of the teachers in our school district, and they will have an assigned room, which we have that in, so they can work in an area and be away from people. That's very important. The other is to have an area of the only time a parent, if you come and get your child, we'll have you call in and you say, this is Johnny Jones. We'll make you, we'll probably do some pre-questions and make sure we know who you are. We'll have you pull up, get out of your car, and then we would bring your student out with you, checking on that. We can't have people come in. The one thing you can do is bring medicine. If someone forgets medicine and the nurse calls you and says, hey, can you bring this medicine? Then that'll be allowed to be delivered. Everything else we don't want. So we're not going to allow lunches to be delivered. We're not going to allow homework to be delivered, band instruments to be delivered. Gifts to the superintendent are not permitted. Any of those types of things, you're not allowed to deliver that. And we have to limit that. Now, if you have to pick your child up, we'll work through that and know who you are. So that's basically what will be happening there. How about some other questions? I try to answer as much as I can and help you. I think one of the things is that, someone said about it's good to be transparent. I agree with that. My biggest thing is in my position here is trying to keep everybody safe. And obviously everybody in education, from Mr. Kerr on the window here to Mr. Wright to Mrs. Cavarino, Mr. Quat, Mrs. Combine's online. Everybody wants to come to school. This is why we got into education. And I think the key is, though, you have to do it in a way that's safe. If we find that after the introductory phase, that they really got good treatment and everything's doing good, who knows what's available then? Who knows? And I can't wait till the day when we all can go and we can have the regular school day. And hopefully at that point, parents that maybe don't emphasize attendance will emphasize it pretty good back then. You know, once we get back to the 180 day every day, I would love to see that, you know. So maybe that'll be one of the positives coming out of them. We are still scheduled right now to start school on August 25th, which is that Tuesday. That would be a 4-day week. Yes. Students should bring their own masks. I think a student will feel comfortable. We will have extra masks available if someone forgets. I know there's going to be some groups that are going to sell masks as fundraisers. I think also, probably going to ask the PTOs to help out with that as well. That would be a great thing to help. I think it's kind of funny because I think schools are going to start, whatever how you wear your football jersey or your soccer jersey on game days, you'll wear your mask probably in school to show everybody I play soccer. So I think those are things that we'll have extra masks when someone forgets them. Obviously, in the elementary school, you have to teach students how to wear a mask, when to wear a mask, and that type of thing. So that's not easy as well, but that's something we can teach kids. And I do think kids are very resilient.
Dr. Matty, could I interject a quick question?
Yes, you can, ma'am.
I'm not sure if I understood you correctly at the beginning of the meeting, but if students are in a classroom where they're able to be socially distant 6 feet apart,
yes,
are they able to remove their mask during that class
as
period?
of today, because I'm saying as of today, because I never know what kind of information I'm going to get tomorrow.
Right.
As of today, yes.
Okay.
Based on the thing, if you're 6 feet apart and the room has good ventilation.
Okay.
If it's an internal room and it doesn't have good ventilation, then we'd have to look at that. But I'd say yes. Someone wrote on here, masks are controversial. They're politically controversial. But as far as, from my perspective, the governor has told us we need to wear the masks. That's one. From my personal experience of being in a situation with already being in a pandemic, I know a mask will help improve the odds that we don't spread it as fast. So there's really no argument here for us with that. That's part of the thing. If you felt like your child can't wear a mask at all, and they do not have a situation where they have an ailment that they can't wear a mask, then you probably want to look at the hybrid option. Someone said, "Well, there'll be discipline." Not going to be discipline. It's just they can't come to school anymore. They're going to have to go on hybrid if you refuse to wear a mask. Yeah, the desk should be 6 feet apart, desk and or tables. If that's the way it is, you can pull down your mask and breathe more readily. If we find that there's new information on that, we would certainly reveal that to everybody. Right now, that's the information we have as of this point. How about another question? Anything? I'm trying to think of maybe something. I can't think. Is there anything else anybody want to ask? I schedule these about an hour because you do cover pretty much an hour's worth of stuff. Any comments from anybody? Yeah, what we'll do is we'll ask everyone about busing, for example, too, though. If you intend to ride the bus, we can still put a spot out there, but we really want to know, because there are some people that, even though they assign a bus to them, we know you've never used the bus. So that would help us in our planning.
Another quick question, if I can.
You can.
If students are being kind of like half the class is coming one day and half the class is coming the other day,
Yeah.
Are you going to try, and I can't even imagine the figuring of this out, but for families, are like all my
Yes.
kids going to go on one day, or are they
All
gonna...
except you. We came to you and I said, no, don't help her.
Okay.
Mr.
Thank you.
Mr. Jewell did that. That's our first way to divide was that.
Okay. Gotcha.
So, because if you're working and you have a child that's a 10th grader and you have a child that's a 4th grader, then the 10th grader can watch the 4th grader. Or in some families, vice versa. Some
Right.
4th graders are more responsible than 10th graders.
Yeah.
But that's the first thing. And we'll, if someone has a situation that when they get their A-B assignment, if that isn't right, then they can call us and we can look at changing that over for that. That's a good question. That's one way we did that. That helps having the ALMA system, being able to do that. Some other things we just look at some other areas, but that's a main one. The other one could be the type of class, trying to divide that class out in half and giving more, an ability so it's not 20 one day and 10 the next day, that it's 15 each or something like that. The average room probably can fit about 12 kids relatively easy, but it depends. There's some rooms that are bigger than others. "21 kids will not fit in a class and be 6 feet apart." That would basically be classes that would be delegated to the library area or the auditorium or the cafeteria when we're not in use. So that's why if you have a big class like the band, for example, the band would probably be divided into 2 or some other situation, and we would use bigger areas than the normal classroom. It's a good question. If a student tests positive, the Department of Health guidelines that we've gotten to this point was if you are not socially distant or you're with someone for a certain length of time in the past 48 hours since they were tested. That again is why. So if that's the case, students, if you knew that a student was in your class and say they got a test, but they didn't tell us, then they came in and then the mother calls us and said, well, we got a test Friday. The results are here Monday. Johnny has a COVID. In that particular case, then those other students probably, if they were with him, would have to quarantine. But that's the point of the testing and the tracing and all that. And being we're a governmental agency, we really need that assistance from the Department of Health. And I would implore all of you, if you want kids to go to school, you need to pressure your legislatures. I have not heard from a legislature about this yet. I'm talking representatives in Pennsylvania. They seem to be around when we win a football championship, but they're not around when they want to talk about testing and needs. And I think they really need to look at that and stop. I don't care about the politics. I really don't. I want to keep everybody healthy. And I've been in the situation where people haven't been healthy, and it's not fun. So we're going to keep everybody as healthy as we can and be transparent, unless there's a situation I'm not allowed to tell you. But, we'll continue to do so. But, I've gotten a lot of good questions today, and I really appreciate it. Hopefully, we might have one of these again because everything could change in a month. That's certainly something that we'll have to discuss again. It looks like a lot has to do with the positivity rates of cases in the county, and hopefully they bring that down to under 5%, and that'll improve things. And I hope everybody had coffee today, or at least tea, or ginger ale, or whatever you have in the morning. So I appreciate everybody tuning in, following the Matt Main etiquette. I thought that was good. I do a lot of talking, but in this case, it's probably good that I do. And then we'll we'll talk again. But if you have any questions, you can always email the principals, email me, and or some faculty if you had specific questions that would be relevant to them. Okay. Thanks, guys. I really appreciate everybody coming in, and we'll see you next time. And tomorrow we have a board meeting. I'll present a lot of what I talked about today, and we'll go from there. Okay. Thank you. Appreciate it.